Good evening. My name is Olivia, and I am a Communications Director for Congresswoman Lois Frankel. Thank you for joining our interactive Access Live telephone town hall event. This event will give you the opportunity to speak directly with Congresswoman Frankel and local health experts. As I mentioned, this is an interactive forum. If you would like to ask the Congresswoman and guest speakers a question, you can press *3 on your phone keypad at any time, and you will be placed in line. An operator will take down your name and question. If your question is selected, I will read your name and question for the Congresswoman and our experts. If you are participating online, you can submit your question below the streaming player. Again, if you have any questions throughout the event, please press *3 on your keypad. That's *3. Now, I'd like to turn it over to Congresswoman Frankel.
Hello, everyone. I'm Lois Frankel, your member of Congress, and I want to thank all of you for joining me tonight for this telephone town hall on the coronavirus pandemic. You know, we are in a worldwide pandemic that's disrupting all our lives, our health, our pocketbooks. So I hope that this town hall will answer many of your questions. As we've been told, staying calm is important, but we want you to take this seriously. You should know that public officials, healthcare workers, and others have been working around the clock to address this pandemic. But with that said, please keep in mind you are the best defense against this disease. So I'm going to start off with advice you've probably heard from before from the Centers of Disease Control. Practice social distancing, wash your hands frequently, don't touch your face, disinfect surfaces thoroughly. I want you to know that I'm following this guidance as well, which is why we're hosting this town hall over the phone. And I have joining me a very knowledgeable panel. Each one of us is in a separate location to help me with your questions. They are Nikki Freed, the Agriculture Commissioner, my colleague, Congresswoman Donna Shalala, she's the former Secretary of Health and Human Services, Dr. Alina Alonso, the director of our Palm Beach County Health Department, and Dr. Martha Rodriguez, a local practitioner. Also, Karen Brill, a member of our Palm Beach County School Board, and Todd Von Laren, Assistant County Administrator for Palm Beach County. We've also invited other state and local officials to listen in. So I want to outline what you can expect on this call tonight. First, I'm going to outline what Congress has done so far to address this pandemic. And then we're going to have Congresswoman Shalala outline the international and national spread of this disease. And then we're going to take your questions, which will be answered by our panel. Just to let you know, we have lots and lots of people listening to this town hall. So in order to get through the questions as quickly as possible, Olivia is going to relay the questions you ask. And if you don't get your question asked, please leave it with the operators and we'll get back to you. During the call, I may refer, or others may refer to websites for more information so that we're not repeating ourselves over and over. I want to let you know this now. If you go to frankel.house.gov, that's frankel.house.gov, a lot of this information will be on the web page. Now let me just tell you quickly what Congress has done recently, which is to take immediate action to tackle the public health and financial impact of the pandemic. 2 weeks ago, Congress passed an $8.3 billion emergency funding package, which included money for our national and local healthcare systems and billions of dollars for small businesses to get low-interest loans. I think we're going to have a question on that soon. We also just had signed into law the Families First Response Act, which addresses a lot of concerns many of you are having. It established emergency paid and sick leave for people who are employed by businesses that have under 500 people. There are tax credits for employers. There's also in that, because our schools are closing, we make sure children who are getting their main meals in school continue to get food assistance. And again, you can go to the webpage to see where the children can access the free lunches. The bill also enhances unemployment insurance. And just as a side note, to let you know that myself and Representative Shalala and other Florida members of Congress have sent a letter to Governor DeSantis asking him to increase benefits and streamline the system. And also, very importantly, the bill makes coronavirus testing free. So if a doctor sends you for a test, regardless of whether you have insurance, the test is free. Any other questions you have about what Congress has done, we will let you know as you ask your questions. And also to let you know that members of Congress have been on hours of telephone conference planning the next congressional action, which we believe must be very, very big economic stimulus to deal with the severe economic fallout. And just before I turn this over to Congressman Shalala, I wanted to let you know that I called on the governor today to close all non-essential businesses where people gather, because I think this is something we must immediately do to defend ourselves against this disease. Now, Congressman Shalala, thank you again for joining us. Would you help the panel kick off with, you're going to give us an overview of the epidemic.
Well, the epidemic obviously started in China, and China has still had probably a third of the cases have been in China, but it's spread around the world. And many people know about Italy and about Iran, which are the other two places that have been literally overrun. But as we do more and more testing, there will be more and more cases. The actual number of cases is well over 200,000 around the world. In the United States, though, we've had 11,274 confirmed cases and 157 deaths. Those numbers, in my judgment, are low because we simply haven't gotten enough testing out. But they've occurred in 50 states, including plus Puerto Rico and Guam and the Virgin Islands and the District of Columbia. So everybody has at least one case. In Florida, we've had 390 cases, in my own district, there have, which is most of Miami-Dade County, there actually have been 86 cases. But these numbers will double in terms of the number of people that are positive. It doesn't mean that will result in death, because the most vulnerable population are senior citizens and those who have underlying health conditions like cancer. They're the most vulnerable in our community. This virus is different. We have no treatment and we have no vaccine. So all we have is a set of preventive measures that I'm sure the public health people will decide. But our country was slow to get off and start testing. We still don't have enough testing kits in Florida or really any place else in the United States. So expect these numbers to double, but I want to emphasize that most of the people who test positive will have relatively mild cases, but it is a deadly disease if you're a senior or if you have underlying health conditions. Back to you, Congresswoman.
All right. Well, thank you very much on that dismal note. So just to let everybody know, we literally have thousands of people on this call tonight. Thank you all for joining us. This is Lois Frankel. I'm repeating that because people are joining us over the next few minutes, actually the next hour or so. So, Olivia, let's start with our first question, and please just remind people how they can ask a question.
Sure. Thank you, Congresswoman. So you can press *3 on your keypad for the chance to ask a question. Again, that's *3. So we're going to kick off tonight's call with a question from our website. Alan asks, there is not a roadmap if you are a small employer that needs to either lay off staff or cut their hours. There is information coming from many directions. Can you make this easier for business owners to know what to do?
Well, first of all, thank you for that question. I have to tell you that I've been fielding those kind of questions all day from small business owners who are trying to do the right thing to protect their employees. And I think we can all agree that our small businesses are the lifeblood of our community. So we need to do what we can to get their support and make sure that people have a paycheck. Obviously, we can just, you just run around the streets. If you're on your walk, on your social distancing walk, you can see how many empty storefronts we have right now. So, number of things. For the small businesses, that's for businesses who have less than 500 employees. We passed, there are two ways currently to get some help. Florida has a short-term loan program, which you can go to their website, the SBA website. Actually, it's floridajobs.org. But again, easiest thing is to go to my website for all this, and we'll tell you where to go, which website to go to. But there is an immediate bridge loan program that Florida has in place. More importantly, Congress just passed a multi-billion-dollar program, which is going to allow small businesses to apply for loans that can go up to 30 years, very low interest, 3.7% low interest, 30-year loans, which will be available with credit. That program is currently being set up now. Be on the lookout for that. Again, going to my webpage, or you can go to the disaster loan, SBA.gov, or floridadisasterloan.org. There's a number of websites that you can go to. Now, for employees, this is a tough one because if you have, for example, a restaurant that just shut down or a hotel that just shut down, some people really immediately are out of work. Right now, Florida unemployment, unfortunately, is not great. It's very, it's an onerous process, and it's not a lot of money. But with that said, we are working diligently to get the process streamlined. In the meantime, you should go online. If you are unemployed or your employees are laid off, they should go on immediately to the Florida unemployment to try to get that. There's also in the new legislation, there's for certain people who work for companies that have less than 500 people, there's going to be emergency paid leave. That's to care for a child whose place of care or school is closed. And that's going to be 12 weeks, maximum of $10,000 total. There's some exemptions. And there's also emergency sick leave for people who are actively seeking the diagnosis for coronavirus, or they're caring for a child, a sick child. Now, the beauty of these programs is that the small business owners, when they pay their employees for the sick leave or the family leave, the employer will get a full tax credit. And that means they get the money back in full, 100% from the federal government. And I want to just tell you that, listen, there's some loopholes and that we're trying to fix in the next bill that we have in Congress. But in the meantime, there is these emergency sick leave and paid family leave is available for certain folks. And we urge you to just go to either my webpage or you can go to floridajobs.org.
Okay, thank you, Congresswoman. If you are just joining us for our live telephone town hall, welcome. Congresswoman Frankel wants to hear from you tonight. You can press *3 on your phone to ask a question. Again, that's *3. Now let's take the next question. Tom from Boynton Beach asks, how do we know if food is okay to eat, especially fruits, vegetables, and meat?
I would say Dr. Alonso. This is Dr. Alonso. She is the director of our public health here in Palm Beach County. That sounds like a question for you.
Would you mind please repeating that question again?
No, this is
Sure.
for Dr. Alonso. Yeah, go ahead.
Let me repeat it again for you. How do we know that food is okay to eat, especially fruits, vegetables, and meat?
Well, hi. Thank you very much for having me here tonight. These are very interesting questions. So when you check food, you have to check for several things. One, you have to check to make sure that it's fresh. That's usually a visual inspection. Then you have to make sure that it's not something that's being called back. So it's good to stay aware of products that are being called back. It's usually on the news or on your favorite print material that you get for the news. And then you need to check the expiration dates on things. Even some things that come in fruits or packages have expiration dates. One expiration, it may say that it needs to be bought by a certain date, and then depending on what type of food it is, you have a certain shelf life that you have in your refrigerator versus your freezer. So you can usually get that kind of information on the website and check what it is and what kind of shelf life it has. That's usually most of the time when things actually spoils in your refrigerator, those scientific experiments that we find in the refrigerator after many months of being there. So obviously, those are the two main things that I can think of in terms of making sure that what you're eating is healthy.
Dr. Alonso, I think what people want to know is whether or not the coronavirus is spread through food. And so I think that's the question. And then what about the packages that the food comes in?
No, the coronavirus is a transmission to humans. So it has nothing to do with food. It does not affect the water. I think that's why maybe people have been going crazy trying to store water, thinking that the water could get contaminated with the virus. That is not true, and it's not going to be on the food. If a person sneezes on, let's say, a package of grapes, okay, on the outside, and then you touch that package, you will have the droplets, and it's very important that everybody learn that this is a respiratory droplet disease, and it's not like tuberculosis where you have it spread up into the atmosphere and into your vents and your air conditioning. It is not that. It is droplets. So if you touch those droplets, then it'll be on your hands, and then it will not go through your skin, but if you bring your hands to your face or your mouth or your eyes, then it can go into your upper respiratory and then down into your lungs. That's where it does the damage. So it's pretty hard to actually get it that way. The other advantage is that once it dries, then it will the virus literally shrivels up. You can look at it under a microscope, a very powerful microscope. You can see it shrivel when the virus dies as it dries out. So from that perspective. Now, if you have someone sneeze, like when you are in a, let's say a buffet, and you're eating salad, you notice that there's a glass between you and the salad. That is so that people don't cough and sneeze into the food that you're going to eat. And that is one of the ways that people get hepatitis A and other things that are contaminated in the food. So if that were to happen and you eat it, if it goes through your mouth and down into your lungs, then you would catch it. If it goes all the way down into your digestive system, then the acid in your stomach kills it and you're good.
Okay, so I want to just, I know a lot of people are shopping, they're bringing home food from the groceries, or they're doing takeout. Should they, when they get their food home, their cartons or whatever, should they wipe off the boxes with a wipe, or can they just wash their fruit with water?
Yes, those are two separate questions. So let me take the fruit first. You should always wash the fruit. The most dangerous stuff on the fruit is literally feces from wherever it's being picked, or the people picking the fruits and especially vegetables like lettuce and things like that. would have feces on the ground and then not be completely washed. So it's very important that you wash your vegetables very well anytime you eat them. Now, the second part, in terms of you coming home with a box, again, the most likely thing is that whatever has fallen on that box has already dried by the time you get it. So instead of wiping boxes, what I do is wash my hands. So whatever's on the box, and by the time you get it home, it's completely going to be dry. But let's say you pick up the box at the store, what I would recommend is that you don't put your hands along your face so that you don't catch it. You can carry your little bottles with you of sanitizers or anything that has 60% alcohol. It doesn't have to be the sanitizers. The sanitizers just have 60% alcohol plus some aloe cream or some cream in it to make it smooth and not run as fast as the alcohol. But alcohol is basically what's killing that virus on your hands.
We have on the line with us our Agricultural Commissioner, Nikki Freed. Commissioner Freed, do you want to say something about the food question?
Yes. Yes, and first of all, thank you, Congresswoman, for having me on today. We have been in constant communication with the FDA as well. And so per all of our conversations and all of our calls and all the research out there, there's absolutely zero evidence that COVID actually is transmitted on food. So again, as you just heard, make sure you're always washing your fruits and vegetables. That is, a constant go-to issue, regardless of COVID. But the other thing I want to let you all know is that we are also in constant communication with all of our agricultural producers and processors on a pretty frequent basis, including a all hands on call yesterday, to make sure that they too are following all the appropriate protocols, sending all of their workers home if they're sick, making sure that their workers are healthy and that there's nobody on any of their lines that can transmit the disease. They also are doing social distancing even inside the manufacturing facilities. And also, while we are kind of scaling down a lot of our internal employees, all of our inspectors are mission critical and are still going out to facilities. And our inspectors have also gone through the appropriate protocols, making sure no one's got any conditions that would be COVID-19 or have any other potential risks. They also will not have traveled any time in the next 2 weeks. So we are working with all of our ag producers across the state to make sure that they are following all the appropriate protocols, and we are still having all of our inspectors checking all the foods as normal.
Thank you. So the bottom line, folks, it sounds like you can eat food. The food is safe. You just take your usual precautions, clean your fruit and vegetables and so forth. And we have another question, Olivia.
Yes. So the next question, we've actually been getting a lot of questions from people on the line about testing. So I'm going to read a few of them for you so you can discuss it. People want to know, where can I get tested, and why does it seem like other counties have fewer cases but more tests? Is there a system in place in Palm Beach County to alert people who may have been exposed?
Okay, I guess, Dr. Alonso, that one is for you. And Dr. Rodriguez, if you want to make a comment about private testing or sending patients for testing, you can do that too. Dr. Alonso, kick it off.
Yes, first of all cases that are reported to us as positive, we do a full epidemiological research on each one of those individuals. We have to ask them about all their contacts, where they've traveled. It's quite an extensive set of questions that we do. From that, we then determine what kind of circle we have to do in terms of contacting other people and either having them isolate at home or watch for symptoms. So that depends on whether the person who was positive is symptomatic or not symptomatic. If they're not symptomatic, then the people around them in their near vicinity that they've been in contact with would have to be just reported for symptoms, watched for symptoms. If they are symptomatic, then they would have to then be watching for 14 days of actually staying home. So it all depends on a lot of the questions that we ask. Sometimes when the media calls us for those answers, we have to tell them that it's still under investigation, because it takes a while to contact all those people that have been close or nearby this individual. We have to find out where they've traveled, who they've seen, where they've gone, and it's quite exhausted kind of a list that we have to go through to determine all those things.
Dr. Alonso, I think some of the questions were, where can someone get tested? Is there testing going on in the county? One of the questions was that it seemed like there was less testing going on in Palm Beach County than other places. So I think people just want to know what is the process of actually people getting tested?
Well, the first thing for testing is that people, we've been testing people who are symptomatic. So if a person has fever, coughing, sneezing, difficulty breathing, that would be a candidate. We no longer ask for travel since there's already community spread of the disease, so we no longer ask about travel. If someone's been in close contact with somebody who's positive, we would recommend testing. Now, that's what we recommend. However, it's your doctor, the one that has to, they know your history. They will probably first ask you if there's anything else going on. So many of the people that we have tested that have been negative, we have a lot more people negative than positive. So a lot of the people that have been negative actually have influenza still now. So that's one of the things that we do is make that recommendation. Now, where you actually go is there's two different ways. One is your doctor is supposed to do a swab like that when they test you for the flu. They take that swab. It has to go deep into your nose and down your throat. They put that in a medium, like a liquid, and in a test tube. They take that test tube. It gets shipped then to a lab. They can either do our state labs, which the state labs are in Miami, Tampa, and Jacksonville, and they run the test. Or now that we have some of the commercial labs, they take it to that commercial lab, and then they run the test. Now, unfortunately, if a state lab runs the test, sometimes they send their test from here in West Palm Beach, they send it all the way to Utah or Colorado. So then that test has to come back from that location, and it usually takes longer. So that's the way to get the test. Now, for the people whose doctors do not do the swab, it's been extremely difficult because the commercial labs were not doing the swabs. So we're still waiting for the commercial labs to get on board with the swabbing. We have invited outside laboratories who have recently gotten approved to do some of this, and they're waiting also to get more swabs and actual test kits. So right now it's very frustrating for a person who is not critical enough to go to the hospital, because you should not go to the hospital for testing. They will not test you unless you're critical to begin with. So it's very frustrating for folks right now unless they know a doctor that's doing the swabbing, that has the material to be able to get tested.
Dr. Rodriguez, do you want to add something from the private provider point of view?
Yes, good evening, and thank you, Congresswoman, for inviting me to this event. But I wanted to say that testing is a big challenge, like Dr. Alonso said. None of us have the ability to test people as they're calling. I think the bigger issue is to reassure people that the biggest way to do this is to prevent this. As of now, as of Monday, I have a practice of about 4,000 patients, and we received 20 tests from the commercial labs, which means that there is no way that we can provide testing even to the people that have symptoms. So my strong advice to anyone who calls for a test is that they stay home, they quarantine themselves until they're better, and protect the people around themselves. I do know that there is a commercial lab that merged with Roche, and tomorrow we'll start giving out about 20,000 tests a day to Palm Beach County. I still feel that the biggest way to treat this is not to do a test, is to protect yourself and the people around you from getting this.
If I may add something,
Yes, I was going to ask you to.
This is Dr. Alonso again. I want to add one thing. This is very important what Dr. Rodriguez just said. If you're test positive or if you're not tested, you're going to be treated the same way. Because if you have the symptoms and you think that you may have it, what you're going to do is stay home for 14 days until you get better, whether you have the test or not. So that's something very important.
Yeah, Dr. Alonso, is it true that you could have the virus not yet test positive, or you could not have it and then be exposed to it the next day?
Right. So let's say you are just afraid of it and you decide to go get a test and you find somebody that will actually test you and run the test. That test is only good for that day you have it. You might go run into me at the corner and I sneeze on you, then you got the test, then you become positive. So testing people that just for the sake of knowing whether or not you're positive doesn't help us. Now, the more tests we do, the better statistical analysis we can do on the virus. And people like myself who are in epidemiology and public health, we want to know what that fatality rate is for this virus. So the more people we test, we're going to find that the fatality rate goes down because there will be more people who, the fatality rate is the number of people who die divided by the number of people who have the virus. Right now, we're really only testing those who are very critical in the hospitals or those who become very sick. So obviously that fatality rate will go down if we test more people who are positive but don't really get that sick. And probably the majority of the people who get it, like we said in the very beginning, are going to do just fine and recover without much difficulty.
So I want to just emphasize this, Doctor, and it sounds to me, Representative Shalala, if you want to add something to this. We have been on many conference calls this week with the state, with the federal government, and so forth, and we believe that the testing is very we're in very short supply here in Florida, especially Palm Beach County. I mean, there's very little testing going on. This is not a criticism of our health department. It's just that the entire country is not that well prepared to do this testing. But I want to emphasize what the doctors have said. We can defend ourselves. The best way to defend yourself is to practice the social distancing and constantly wash your hands. Don't touch your face. Use your disinfectants. And don't be misled by low statistics. We don't really know how much virus we have here in Palm Beach County. Is that correct, Doctor?
Right. We only know what we've tested, what is positive, and what is negative.
Okay. All right. Let's go to the next question, Olivia.
Sure. So the next question is coming from Eleanor in Delray Beach. She wants to know, is there anything being done for people who need supplies like hand sanitizer and wipes? And then we've received other questions as well for people asking specifically for healthcare workers, how are they going to get the medical supplies they need?
Who wants to take a stab at that one?
I'll take that one, Dr. Alonso. I'll take that one. We have set up, one of the things we have very, very well done in Palm Beach County is we have an excellent emergency operations center and emergency department that we work very closely with all our fire rescue teams, with our law enforcement, health department, and all the other essential functions of an operation like this. And so what we've done is we put in orders to the state, which then get all the way up to the governor's office, and then the governor can advocate for things coming down to Florida. The problem is that Florida has maintained a pretty low profile in this case. You know, all the cases over in California, Washington, New York have really put all the resources into those communities, and it's just now that they're starting to bring resources to Broward, who now has high numbers. Miami just passed them with 103. So those resources are being now brought to those areas. So with our county only having, below 30, we're not getting a lot of attention. But we're screaming as loud as we can because we're saying, hey, we don't want this to be a competition for who's number one with the most cases. We want to keep our cases down. And so, therefore, the most important thing that we need right now is the masks, gloves, everything to protect the healthcare workers and the fire rescue who go out into the community and pick people up, and law enforcement who also goes into situations where they have to pick people up. So these people have to be protected, not only so that they can keep working, but also so that we don't spread the virus even further. And on top of that, let me just make the distinction between the surgical masks, which are those square, kind of oblong squares that people put, and then you see the little two ties behind their head. Those are really supposed to be put on the patient who might be coughing and sneezing so that that patient doesn't cough on other people. They will not protect you for the virus if you're walking around the street because it has openings on the side of your face and your nose. In order to be protected from the virus, you have to use what's called an N95, which is almost like it looks like a cup that fits on the top of your nose, and you have a little metal clip on it that makes it get tight, and it has to fit just right. In order to get the right mask for that, you actually have to be fit tested so that you know what size mask you need, and that's the one that actually protects the healthcare worker from the patient who is contagious.
Thank you. Donna Shalala, are you still with us?
I am.
You might have gone up. You are, Donna.
No, I'm here.
I think people need to know the truth about the supplies and so forth. Would you like to discuss that a bit?
Well, I think we're way behind in terms of providing supplies. Every hospital in the country is desperately trying to find masks, for example, and gloves. Some of these things are provided from the stockpile, but I think the stockpiles are running out. And recently they've gone to the Defense Department because they have stockpiles to tax into those. But we started 2 months late. We're trying to play catch up now. And I think in terms of protective gear, I'm particularly concerned about healthcare workers, not just the doctors and nurses, but other people that work in our health facilities. And we're just not getting either supplies or test kits. The supply chain is broken. And I know the administration is trying desperately to fix it. But it's going to take some time. Even with the private sector, the commercial people who have done most of the testing in this country coming in, they need test kits too. They don't automatically have them. So we're going to have to put up with this broken system for at least a month, I think.
So just to say, this is not a reflection of our health department. And we're trying
absolutely not.
Right, and we're trying not to make this political, but I think some of us feel strongly that the administration waited too long to get a jump start on this, and so we're behind in getting all these supplies. But I want to let everybody know that there are a lot of people who are working literally around the clock to try to make this happen.
Lois, if I could make another point,
sure.
Particularly about state and local public health people. We have for years underfunded our state and local public health people. Democrats, Republicans, both parties are responsible for not understanding that the first line of defense is our local public health people and our state public health people. What we're seeing now is the result of years of underfunding. Now, we obviously have been giving money to the CDC, to the NIH, and to the FDA. They have been underfunded, but not nearly as much as state and local. And I blame both parties for that, but it's no use blaming anyone. At this point, we all have to work together, and this has to be a nonpartisan issue. But our local people are really the people that are going to save lives, along with their state counterparts.
So there was a question about hand sanitizer wipes. Anyone who's been to the market, it's hard to find. You can't find hand sanitizer or wipes or toilet paper or paper napkins. I mean, paper towels. They're all off the shelf. I do not. Maybe Todd, do you know if there's any effort, if there's anything in the pipeline?
So thank you, Congresswoman Frankel and Congresswoman Shalala, for this meeting. We're at the EOC actually right now. Dr. Alonso and I are still here and continue to work with our team. What we do is we have a web EOC, which is our, kind of docket to communicate with the state of needs in our communities. We have received some supplies, and some of the things that we're really focusing on right now are, many of our first responders in our community, and we've really made a concerted effort to try to prioritize, those as essential functions, because we know throughout this ordeal, even as we look to minimize, individuals going into public places and workplaces, that our first responders and frontline workers are going to be working pretty much 24 hours through this entire crisis ordeal that we're in right now. So we've certainly been working closely with them in the state to get some of those supplies, because really in the continuity of operations of county government, and I think that this goes the same for Broward and Miami-Dade counties, we've got to keep some of those essential functions going and keep our workers healthy on the front line so that they can help serve our public. So there's been a lot of emphasis on that so far in terms of those particular requests. We are working very closely with our grocery stores, our retail outlets that are open, our pharmacies, to do everything that we can to support, their supply chain. But we obviously know that there is a very limited supply of that, and we know that the Publixes and the Walmarts and the other stores, have been doing everything they can to restock closing hours to try to make sure that they can get that restocking in there. So while our priority has been on the first responder piece, I think we've been working diligently to try to meet as many needs as we possibly can throughout our South Florida communities.
I have a couple of ideas of what people can do for hand sanitizers. You don't need the regular commercial sanitizers. Like I said earlier, if you use 60% alcohol, you can use the alcohol directly. You can mix it with any kind of aloe cream, and that gives you pretty much the same thing as what you have in the bottle. The other thing is to use the alcohol wipes. The alcohol wipes actually have 60% alcohol in the pads. The other thing is there are multiple surface cleaners that are not the wipes that everybody is wanting to get. You can use the spray just as good as the wipes. I think we've all gotten used to using the wipes, and we forgot that there's commercial products, even ones that say now on the label that it kills the coronavirus. It's the same label that they use for H1N1, except they added corona, because if it kills H1N1, it also kills the coronavirus. The other thing is to remember that you can make a bleach solution, and if you can't remember, just go on Google and see how to make a bleach solution for disinfecting. It'll be on there, and you'll get the proportions correctly. It's just like making a martini.
And
Thank you for that.
It's Commissioner Freed. I just wanted to also chime in, not necessarily on the paper supply and the sanitizers, but more so on just the food supply chain. I just want to let everybody know that we have been in, again, communication every day with Publix and all of our other grocery stores across the state of Florida. They are not anticipating any shortage of the food supply chain. That's why they are closing early, just to make sure they can restock. They've increased their shipments out to each of the stores from 2 shipments a day to 6 or 8. So they are not concerned whatsoever about the food supply, and we're really asking people to not hoard food. You're going to still have access to the foods that you need, but what's happening is when people go into the stores, there's nothing there for them at that moment. So please make sure you're not hoarding food. There will be food there. We have been assured by all of our suppliers as well as all of our producers that it will be business as usual on getting the food out to our public.
Thank you so much. All right.
Congress.
Oh, sorry. Yeah, go ahead.
Congresswoman, may I say something,
yes.
please? This is Jackie Rodriguez. I wanted to add something from the small guy perspective. I think we should all use common sense. A house is built with a brick at a time. So if all of us at the small level take very strict measures to conserve supplies, like for instance, in my practice, I have only allowed two employees to be exposed at a time, rotating the exposure of the employees and minimizing the utilization of supplies. For instance, we have locked out the injectables. We make very strict criteria for injectable IV fluids, nebulizer treatment, and constantly remind both the staff and the patients to stay home. The nebulizer is not the answer. The steroid shot is not the answer. By all means, the antibiotics are not the answer. So conserving supplies at the very little level is as crucial as having supplies at the large level.
Thank you very much for that. All right, Olivia, what's our next question?
Sure. So our next question is from Lori in Boca, and she asks, is it okay to see grandchildren after a probation period? And on that same theme, we have another question from Tom. Tom is 75 years old and healthy, and he wants to know, he's social distancing right now, and he wants to know if he should still worry.
All right, look, I'm glad you guys asked that question because I have a little grandchild and I haven't been able to hug him in a couple of weeks, and I just want to know when am I going to be able to do that? So can you answer Lori and Tom's question?
Sure. This is Dr. Alonso. The danger is obviously to the grandparents, not the other way around. Now, I imagine you mean if a person is in quarantine after they get out of the quarantine, that if the person was positive and they're out of the quarantine after the 14 days and they recover fine, then they have immunity against that virus. So they're not going to catch it anymore. They can go out in the streets and shop and do everything. They don't have to worry about catching this thing again. In terms of the kids, so in that case, if that father is positive after his 14 days, he can hug anybody he wants at that point.
So what if he's healthy? What if he 75 years old, he's healthy? Should he hug his? I mean, let's say he didn't have the virus. Can he hug his grandchild?
Okay, if he doesn't have the virus and he hugs his grandchildren, one of the things that we know is that little kids pick up every germ that's out there. So that would put someone at risk. So your best thing is to give them a bump on the leg or something instead of hugging them. Now, if you need to hug them really, really bad and you're not afraid of catching the virus, then hug away.
Oh, gee. Okay. So basically you really have to well, what you're saying is that your family members are also can carry the virus even if they're not symptomatic. Is that right? And then they could expose you.
There is some thought and some literature on it being asymptomatic and being able to carry it. You certainly carry it after, that's why we say 14 days, because after you start feeling well, you could still have virus shedding. Most viruses, and definitely you're going to be the most contagious while you have symptoms. So that's the most dangerous time. I think the facts are still out there whether or not you actually are contagious or can spread the virus before and after. But at any rate, the point is with this that you have to use protection and be wise. If the person is not sick at all, if they're just in the home waiting to see if they have symptoms, then without the symptoms, they're never going to get tested or anything. So that would not be a danger. One of the studies that was done in Italy in a very small town was that they were able to test and then test everybody in the whole town. All the people that were positive, they put them to recuperate in an isolated area, all the people that were sick at the same time. They then went out. After the 14 days, they let those people out because they were safe, they could walk around, and they tested more people that hadn't been tested. And after 3 testing, they actually had nobody else communicate the virus. So what that shows that is if you can test enough people to put everybody in quarantine and let them recuperate, then it would be a way to actually eradicate the disease from that town.
Well,
obviously, they were able to do that.
That sounds
yeah,
like
they were able to do it in a very
that's
small town.
not going to happen here because we don't have the test.
Absolutely not.
Okay. All right. So what I just want to make sure we got the right answer for these people who are want to see their grandchildren. I don't know what the probation period is, but I would just say that I think what I heard you saying is if the grandchild is out and about or the grandchild is somehow being exposed to the virus, they could
bring it home.
The grandparent.
Yes.
Bring it. Okay.
Yes.
And then the other question was Tom. He said he's healthy. He's social distancing. He wants to know how worried should he be.
He's going to have to wait till this is over because the only way that he would be completely safe is if he catches it and then he's immune. So as long as this virus is around, he's going to have to be doing the social distancing.
Okay, so everybody, you better get used to a lot of at-home games, I guess, and long walks by yourself. All right, not to be facetious, but I think that's going to be this. We're looking at many months of this. Would you agree?
Yes, with H1N1, everybody remember H1N1 from 2009? It took it almost 3 years for the virus to actually start coming down. And what we will see with this is that now this is a winter occurrence because that's when viruses hit us. And then as the summer approaches, as hurricane season comes and we start forgetting about the virus and we start worrying about hurricanes, it'll seem to kind of go away. And then what it's going to do, it's going to go down into the southern hemisphere because a winter will be occurring in Brazil and South America and south of Africa and so forth. So then we're going to see the virus go down there. And then next winter, that's what happened with H1N1. Next winter, it came back even stronger in the sense that all the people that had not gotten in had kind of forgotten about it. Everybody can kind of put it off the radar. They got tired of it. All of a sudden started coming down with it. So it took us 3 cycles before the virus actually caught enough people that people started having herd immunity.
Oh, boy. Okay. Olivia, next question.
Sure. So we've been getting a lot of questions from people about public places. With social distancing in mind, why are the beaches still packed? What are you doing to enforce the bans? And what about restaurants?
The beaches are packed because it's spring break, and I've never heard a teenager be able to be told to do anything. And we have also visitors that are still down here, and they see the beach, and they can't help but go into the beach. Todd, you got anything about the beaches? You can talk a little bit.
So I can tell you that in South Florida, we've had some extensive conversations amongst our municipalities, counties, about the status of our beaches and restaurants. Miami-Dade has taken the most strict measures so far in terms of, their restaurants closing and just being available for takeout and delivery. And also I know in Miami Beach and in Fort Lauderdale, they also closed, their beaches. Obviously, those are, as Dr. Alonso said, hotspots for a lot of spring breakers coming down. But what we've seen is there's been shifts since those have closed to other beaches. And I can tell you that officials in Palm Beach and Broward County have been working very closely, having discussions about whether or not we keep those beaches open. We've had discussions with the governor's office as well. And my guess is that, over the next 24 hours or so, there'll be some additional measures that we take operationally from that perspective. I think the same goes with restaurants. Obviously, in places where they have not closed, we've implemented measures to make sure that, restaurants are at 50% capacity to try to, again, enforce the social distancing suggestions that we've put out there to the public. But as we see the numbers of this virus continue to creep higher and higher, and we're trying to get in front of that bell curve and flatten that out a little bit, you might see again, additional operational changes in South Florida to some of our restaurants. So our officials are making decisions by the minute and the hour on this and monitoring that very closely and trying to get as far in front of it as we can.
Especially as we start seeing the virus actually have what we call community transmission. That means when we start seeing that the cases are no longer just travel related, they're starting to have unknown contacts, then that means that the virus is spreading from person to person and no longer connected to a travel case or a specific case. So as that comes up, that's when you want to then implement this greater social distancing and then start closing some of these places.
This is Lois Frankel, and I'm going to give you, this is my opinion. First, I wanted to tell you that today, many of members of Congress in Florida, we've written a letter to the governor asking him to shut the beaches. Number two, I have urged the governor to issue an emergency order to close all public places, and this includes restaurants and social clubs where people are congregating or can congregate in social contact. And I want to explain why. We are at war with a disease, and the only way we are going to stop its spread right now, I'm going to say not the only way, but the main way is going to be from social distancing. And if we don't take dramatic steps, we're going to be in a lot of trouble. And I'm going to give just an example. Right now, and I think probably Dr. Alonso and Dr. Rodriguez would agree that our hospitals are working well. There's still enough beds. There's enough ventilators. I mean, the health professionals are doing what they need to do. But all we need is to have one of our communities have a big spread. And then what will happen is we will see such a rush on our hospitals and our health professionals that it not only will make it difficult to treat all those patients, but people with other kinds of illnesses or accidents, it will be hard to get them treated. So we really have to prevent a calamity here. And the best way, I mean, that's the good news is that most of us have it within our power to do that, especially we have a lot of retirees here. They need to defend themselves with social distancing. And but with that preach, let's go on to the next question.
Sure. So
Olivia.
for the next question,
yes.
Yep. For the next question, Manny asks, when will we see a vaccine?
Well, I can tell you what. Go ahead. Yes,
vaccines usually take 18 to 2 years. So they're working very rapidly because they had already been working on this from before, because this coronavirus is part of the SARS virus that occurred before. So they had been working on this already, so we've got a head start on it.
So let me thank you. I was going to say thank you for the question. Manny, I've spent probably before this week when we were back in session in Congress in D.C., I sit on the House Appropriations for Health and Human Services, and I listened to hours of testimony from the CDC and NIH. Those are the top health professionals and researchers in the country, and they assured us that there would be this is not really an assurance. What they said is there is not going to be a vaccine for at least another year and a half. Now, what we might see, and I'd like to ask Dr. Alonso and Dr. Rodriguez, and maybe even Representative Shalala, if you're familiar with it, we did hear that there might be a possibility at least of a treatment before that time. Can someone comment on that?
Yeah, the treatment is the antiviral. Like when you get the flu, they give you Tamiflu. And what that does, it makes you heal faster. It makes the virus go away faster. So Canada actually has done the sequencing of the viral entity, and that helps them then to be able to create the antiviral. So that should be coming, and it usually does come before the actual vaccine. So there's hope for that, and the fact that they've already been working on it, we will probably see it faster than we've seen it in other diseases because they've already been working on it.
Thank you. Well, we have our school board member on the phone, Karen Brill. Karen, could you just quickly tell us what's happening with the schools and how our kids are going to be learning?
Absolutely, and thank you, Congresswoman. So, we have had to shift gears and be as nimble as we can to get our students ready to be learning at home. The governor has announced that schools are to be closed through April 15th, but we understand that we are probably looking at a longer duration than that. And of course, when all of this happened, we weren't ready for a long-term shutdown. So we did close last week. The students only lost 4 days of learning because we were going to be closed for Election Day. And yesterday, the superintendent held a press conference rolling out our online learning. So we will have 3 platforms that our students will be able to access. One of them is going to be a Google Classroom. We will also have through the television network a schedule of courses that will be available over the television on the education network. And then we also have Google Meet. Now, of course, a lot of our students don't have access to the internet and do not have computers. So we are working with different groups to get access for them in terms of computer, getting the ability for them to log online. Comcast is providing 2 months of free service to students. And so this is going to be a work in progress. I did not hear the superintendent's conference call with board members tonight because I was on the phone with you. I will be listening to that. But most importantly is we are going to be working with all of our communities. As Congresswoman Frankel has already said, thank you for helping us feed our students, who many of them, the 3 meals that they receive, breakfast, lunch, and dinner in our schools, are the only meals that they would be getting. So we are feeding our students. We are going to be working diligently to get them to be learning. They will be graded on the work that they're doing at home. Now, the governor has waived school grades. People have gotten confused. We've gotten a lot of questions at the school board regarding when they heard that K-12 schools were not being graded, they thought it was their students. That is not true. Students will be learning. Parents will have the option. The governor is giving them the option. If they want to retain their students, they can. But we're hoping that's not going to happen. We want to keep everybody up to speed. And also, very importantly, we prepared and announced that we are going to be paying our employees that are full-time, such as our bus drivers, our food service workers, people who they have enough worries with the virus not to worry that they're not going to be able to be getting their paychecks. So we are working to make sure, and we are making sure that all of our employees are paid, all our full-time employees are paid. And we will do everything to keep the public informed. For anybody that's listening, if you have questions, there are 2 ways that you can reach us. You can go on our website, which is www.palmbeachschools.org. Again, that's www.palmbeachschools.org. You will see a link to the coronavirus and a link to be able to ask questions. We have hotline numbers set up. And you can also email your questions to us at board office, all one word, BOARDOFFICE, board office at palmbeachschools, again with an S.org. That question will go to all of the school board members, the superintendent, and his cabinet. So we stand ready to help any parents, any teachers, any employees that have questions.
Okay, listen, thank you so much for taking care of our kids. So listen, we're gonna wrap this up. We're gonna take one last question, but what I want to tell everybody, if you have a question and it hasn't been answered, we will make sure that somebody gets back to you. And just to remind everybody that there are lots of web pages to get a lot of this information. including my own, which is frankel.house.gov. I want to thank everybody, all our panelists, for being with us. Very busy, but very important people in this fight against this pandemic. And let's get the last question, Olivia, for tonight.
Sure. So as we're coming to the end of our call, the last question for tonight is going to be from Barbara from Lake Worth. She wants to know, what can I do to help?
Okay, well, that's a Barbara, thank you. Anybody want to answer that question?
You can volunteer. You can volunteer at any one of our health departments. We greatly appreciate anybody that wants to volunteer. Lake Worth, you can go to the Lantana Health Center, right there on right off of Lantana Road, and go over there and tell them you want to volunteer.
What would they be doing? Well, actually, let me just find out. What? Okay, go ahead, Dr. Rodriguez, and then tell us what they would be doing.
You can also contact the Palm Beach Medical Society. They can give you many ideas on things that you can do to help, especially taking care of educating the people around you to take care of this. So the Palm Beach Medical Society is available. Their website is full of information to help anyone help.
Well,
another idea.
Go ahead. Yeah, go ahead.
Another idea is to find a neighbor on your street that is elderly, that perhaps is trying to stay home and not go out, and it's difficult to go get groceries, and offer to buy, to help them buy the groceries, to go to the store and get the groceries for them, and then bring it to their doorstep and leave it at the doorstep so that they can, you don't want to go in and go into their home because that's why they're staying home, but you could leave it at their doorstep and offer to do that for them. That would be very helpful.
Okay, thank you. That was a great question to end with. Again, I want to thank Nikki Freed, our Agriculture Commissioner, Dr. Alonso, the Director of Palm Beach County Health Department, Dr. Martha Rodriguez of Private Health, Dr. Karen Brill from the Palm Beach County School Board, Donna Shalala, my colleague in Congress, and Todd Von Laren from the county. Thank you all for your good information. And let me just end the way I started, which is, everybody listening to this, you are the best defense against this disease. So please follow the CDC guidelines. Obviously, stay home if you're sick, and if you're well, practice social distancing, wash your hands frequently, disinfect surfaces thoroughly. It is up all of us to protect ourselves and our community. Again, please, if you need any more information, go to frankel.house.gov. Thank you all. Be safe and have a good night.
Thank you.
Stay healthy. Good night.
Thank you.
Good night.
Thanks, Lois.